My name is Madison Gray. I'm a student nurse at the University of South Alabama, and I'm going to be performing the indwelling catheter check off. She's going to scan the room. So the first thing I'm going to do is verify the order and the hospital policy. I'm going to perform hand hygiene, and then I'm going to identify my patient using two identifiers. I have the order form and the armband. I have Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963. He has an allergy to penicillin, and then I would explain the procedure to the patient, and then I would evaluate the essential conditions for the indwelling catheter, which would be the required immobilization for surgery, trauma, or other therapies, strict urinary output monitoring as indicated by plan of care, and to assist in healing of open sacral or perineal wounds in incontinent patients. I would then provide privacy for my patient, gather all of my equipment, put my goggles on, position the trash cans where I need it, perform hand hygiene, and then I'm going to raise the bed to the comfortable working height, lower the side rails, and put my patient in the dorsal recumbent position. I'm going to put my clean gloves on and perform the perineal care. So for the male, I would have them in the supine position, and I would place the penis above the towel, and I would grasp the shaft, and I would retract the skin if they were uncircumcised. I would clean, starting at the urethral meatus, inward to outward in circular motions. I would rinse and dry, and then I would clean the shaft with a separate cloth and the scrotum and the underlying skin and rinse and dry. So then for the female, I'd have them in the dorsal recumbent position. I would wash the labia majora, retracting the labia with my non-dominant hand, cleaning the skin folds from the perineum to the rectum, and then I would rinse and dry. And then I would separate the labia, exposing the urethral meatus and the vaginal orifice, and clean with one single stroke from front to back using a separate cloth for each section, and then I would rinse and dry it. And then I would remove these gloves after I performed the perineal care and discard, and then I would open my catheter kit, and put on my sterile gloves. And now I'm going to remove the sterile drape, placing the shiny side down in between the patient's legs. And I'm going to position it all the way to the patient, and normally my patient's legs would be bent up and it would be underneath their legs. Then I'm going to turn this so I can have a better workspace and place the tray onto here. And then I'm going to prepare the cleansing and the lubricant. And now I'm going to get the syringe and connect it to the port, to the balloon port. And then I will remove the plastic wrapper and place this into the lubricant. I would lubricate 1 to 2 inches for the female and 5 to 7 for the male. So now I'm going to do the cleansing. So I'm going to separate the labia, and for the female I will do the outer side, discard, the inner and discard, and then the middle and discard. And if I had a male, I would start at the urethral meatus and clean inward to outward in circular motions 3 times. So now I'm going to move my box closer, and I'm going to begin the insertion of the catheter. So I would instruct my patient to bear down as if they were voiding, and to take deep breaths and exhale during the insertion. And if this was a male, I would put the penis perpendicular to the body. So now I'm going to insert the catheter. So I'm going to insert it until there is return of urine. And once there's return of urine, I would advance it 1 to 2 more inches for the female, or until the biurification for the male. So now once that's inserted, I'm going to hold that steady with my non-dominant hand and insert the balloon port with the syringe, holding pressure onto the syringe. And then I will remove of that and discard of the syringe. And then I will, once that's done, I will gently tug back and then advance it slightly. And now since that's in, I'm ready to apply the stat lock. So how you would apply the stat lock is you would cleanse the area on the inner thigh, and then you would clip this in like this. And lock it. And then you would attach this onto the patient's leg like so. And then when you would remove it, you would unclip it, but I'm going to leave this here and demonstrate how to do that at the end. So once I have the stat lock on, I'm going to hang the drainage bag onto the bed frame. I would not hang it onto the bed rail. You want it to be below the bladder level. And then I'm going to do the specimen collection. So for that, I'm going to get the container. I'll have a towel and a graduated cylinder on the floor below the bag, and I'm going to hold the container upwards. And then I would this way. I would remove the tubing from the catheter and unclamp it, being careful not to touch the inside of the tubing. And then once that's full, I would reclamp and insert back in and place the top back on and label the container. So now I would do that whenever the catheter has just been immediately inserted. So now for the portal part, you would clamp the tubing and cleanse the area according to the hospital policy, like so. And you would clean the port with a swab and clean that area. And then you would make sure you would let it dry and it does not touch anything. And I would also make sure it's not touching anything, would unscrew, make sure it doesn't touch anything, unscrew the cap and hold it upwards and set it aside. And then I would take a syringe and I would connect it to the port and withdraw the urine. And then I would insert it into the container, being sure not to touch the inside of the container. Recap, label the container, unclamp it, and attach the clamp back onto the patient's bed frame. And I would do this after a catheter has been in for several days or hours. So now that I've done that, I'm going to discard of all of my stuff. into the trash can, remove my sterile gloves, position the patient back to the lowest position, raise the side rails, make sure that the call light and the comfort equipment is in reach. I would perform hand hygiene, and then after that I'm going to document. So what I'm going to be documenting is the catheter size, the amount, color, and consistency of the urine return, the patient's reaction, and then the specimen collection. And then I would describe the daily catheter care using soap and water, and after incontinence of stool. Then I would, after I would do that, I would remove the indwelling catheter immediately when as medically indicated. So now I'm going to discontinue the dwelling catheter. So I use aseptic technique. I have my goggles, and then I would put gloves on. I would empty the drainage bag into a graduated cylinder to measure the urine, and then I would remove the catheter from the stat lock and unclamp from the bed, and then I would take the syringe into the balloon port. And before I did that, I want to loosen it up to make sure it's loose. And then I'm going to pull back to 0.5 milliliters, insert it, and let gravity pull the water out. Then I'm going to remove the syringe and remove the catheter and I would dispose of this and provide prenatal care. So after I've done that, I'm going to document. So what I'd be documenting would be the amount, odor, color, and consistency of the urine, the tip of the catheter insertion, and how much water was removed from the balloon, the patient's tolerance, and then the patient's teaching of the symptoms of the UTI, which would be frequency, dysuria, and urgency. And then I would also come back and monitor to see if my patient has voided within 4 to 6 hours. And if they have not, I would palpate their bladder and get a bladder scan. Thank you.